In this video, we will discuss trigeminal system. Okay, so this is anterior cranial fossa. As you can see here, this dotted area, it's anterior cranial fossa. This is middle cranial fossa, and this is posterior cranial fossa. Now, at the petrous part of the temporal bone, this area, we have trigeminal ganglion. Now, trigeminal ganglion has three divisions. First is ophthalmic. See, this is ophthalmic division. This one is ophthalmic division, which exits the cranial cavity through superior orbital fissure and enters the orbital cavity from here. Then we have maxillary division here. This is maxillary division, which is exiting the skull through foramen rotundum. Then we have V3 division. As you can see here, this is mandibular division and it exits the cranial cavity through foramen ovale. Now this is sensory root of the trigeminal nerve. We have one sensory root and one motor root. So where is motor root? Motor root is here, right here. It is not connected to trigeminal ganglion. Now this is motor root. From the pons it travels and then it comes out through foramen ovale along with mandibular nerve and supplies the muscles of first brachial arch, that is muscles of mastication, mom, tensors, two tensors, tensor tympani, tensor veli palatini, floor of the mouth muscles like mylohyoid muscle, anterior belly of the gastric. We have all these muscles, and all these muscles are supplied by the motor root of trigeminal ganglion. Now let's see here this sensory root. Okay, so we have this sensory root of the trigeminal ganglion, and now it enters the principal pontine nucleus. This is PPN, this is principal pontine nucleus, and some fibers enter mesencephalic nucleus. This is mesencephalic nucleus of trigeminal nerve, and this is spinal nucleus of trigeminal nerve, and some fibers enter the spinal nucleus of trigeminal nerve. These fibers which enter spinal nucleus of trigeminal nerve form a tract, and this tract is called spinal tract of trigeminal nerve. And then all these fibers come out from this nucleus and go upwards. These fiber ascends upward and enters the thalamus. Which part of the thalamus? The ventro-posteromedial nucleus of thalamus here. And this tract is formed. This tract is called TTT, that is trigeminothalamic tract. Okay. All these fibers coming out from all these nucleuses and reaching the thalamus also forms a tract. It's like a tract, and this tract is called TTT, trigeminothalamic tract. Now ophthalmic division carries somatosensory sensation from upper part of the face, from this area, this one, from this nose area, from half of the head. This part is all supplied by, all the sensation of this area is carried by ophthalmic division to the central nervous system here. Fibers are going in this direction, like this. Then this is maxillary and this is mandibular. Then we have maxillary division. Maxillary division carries somatosensory sensation, all these touch, pain, temperature, proprioception, all these sensations from this part of the face, from cheek area, from upper lip area, all this part And then comes mandibular division. Mandibular division carries all these somatosensory sensations from the lower lip, from teeth, lower lip, lower gums, chin area, all these area to the central nervous system. So it's like this. And then you already know that we already discussed that motor root of the trigeminal system exits the cranial cavity through foramen ovale and supplies muscles of mastication like temporalis, masseter, medial pterygoid, lateral pterygoid, two tensors, that is tensor tympani and tensor palatini, floor of mouth muscles, that is mylohyoid, and anterior belly of digastric. So what do we have here? We have this trigeminal ganglion sitting on the petrous part of the temporal bone, giving off three branches or three divisions, that is ophthalmic, exiting the cranial cavity through superior orbital fissure here, and then its second division, maxillary division, which is exiting the cranial cavity through foramen rotundum. And here the third division, that is mandibular division, is exiting the cranial cavity from foramen ovale. Motor root exits the cranial cavity through foramen ovale and supplies muscles of mastication to tensors and floor of the mouth muscles. And the sensory root of the trigeminal system enters the principal pontine nucleus, then to mesencephalic nucleus of the trigeminal nerve, spinal nucleus of the trigeminal nerve, and the fibers that enter the spinal nucleus form a tract called spinal tract of the trigeminal nerve, and all these fibers coming from all these three nucleus of the trigeminal nerve enter the thalamus area, ventro-posteromedial nucleus of the thalamus, and form the tract called trigeminothalamic tract, also called trigeminal lemniscus. So here now the fibers, these fibers are called general somatic efferent fibers. All these fibers carry sensation of touch, pain, temperature, and proprioception from all these areas, from half of the head, full face, except this part of the face, from this part of the face, except this part of the face, this part of the face is supplied by cervical plexus. So this part is supplied by cervical plexus. Rest of the sensations from the face is carried by trigeminal nerve. Cranial cavity, nose and paranasal sinus, eye, oral cavity, external ear. Remember, external ear has 4 nerve innervations, that is fifth nerve, facial nerve, glossopharyngeal, and vagus nerve. Now what is trigeminal neuralgia? See, for suppose this is trigeminal ganglion, and it is these are the three divisions of the trigeminal nerve, and this is a sensory root. So if this is a sensory root and there is one artery called superior cerebellar artery which normally runs over here, but in some patients it loops over the sensory root of the trigeminal nerve. I'll use some other color. So this is artery, actually it should be red, but I'm making it yellow to make you understand. So this superior cerebellar artery loops over sensory root while passing over this. This is most common cause of trigeminal neuralgia, because of which there is compression on the root or some nerve damage, because of which there is trigeminal neuralgia. Trigeminal neuralgia we'll take in separate video. This is all about trigeminal system. Now you know how nerve fibers exits the cranial cavity and enters the central nervous system. If you like the video, like, share and subscribe.